Welcome to this year's Mercy Honors Rise Award celebration. My name is Catherine Anaya, and I am very happy to join you today as your Mistress of Ceremonies. We're also thrilled to have everyone joining us here today, our members and their families, our community of providers, community organizations, and advocates. Today, we celebrate and recognize the 2022 Rise Award honorees and nominees. First, I would like to introduce some very special guests who joined us today. Bob Smith, the chair of Mercy Care's board of directors, Jamie Snyder, the director of Access, Mercy Care committee and council members, members of Mercy Care's leadership team. Thank you for joining us. It is now my pleasure to introduce Mercy Care's president and CEO, Lori Bottrill.
Good morning, everyone, and welcome. Thank you for being here today. We are so excited for this opportunity to recognize and honor all the great work that has taken place in our community over the past year. While this past year has challenged and tested us yet again, we've also seen yet again inspiring examples of how our community of members, families, providers, and advocates have demonstrated their incredible resilience, an amazing approach to innovation, commitment to serving others, and a true dedication to empowering those around them. Since we last gathered for Mercy Honors in 2021, Mercy Care has completed our first full year as an integrated health plan for children and child welfare, and we were awarded the ACC REVA expansion contract that will allow us to continue to bring integrated physical and behavioral health care services to eligible members in Maricopa and expand those services in Pinal and Gila counties as well. Over the past year, Mercy Care played a pivotal role in getting vaccines to our members in our communities, including seniors and people with disabilities through mobile clinics. We launched a mobile app to help members coping with chronic loneliness, and we were able to give smart tablets available to our members so they can continue to get healthcare services they need through telehealth. Now we're preparing to deliver access to behavioral health services, substance use services, and eviction prevention services for Phoenix residents through a partnership with City of Phoenix. This year has once again highlighted commitment of our employees, providers, and community partners to put our members at the center of everything that we do. This is the core of who we are and who we will continue to be. I am so grateful for what we've achieved together. Today, Mercy Honors recognizes those who exemplify the best of everything we aspire to be. To all the nominees and honorees, congratulations and thank you. And now, Mercy Care's Board of Directors Chair, Bob Smith, will share a few words with us.
Good morning. My name is Bob Smith. I'm the chair of the Mercy Care Board of Directors. I'm so happy to join you to recognize the nominees and honorees for this year's 8th annual RISE Awards, and to recognize the resilience, innovation, service, and excellence they deliver to our community. Today, we celebrate all of you and your compassion, innovations, collaboration, and advocacy. We have amazing examples among this year's nominees. A physician practice who brought back the house call and then took it a step further into telehealth services, complete with high-definition audio and video. An administrator at an assisted living facility who created an Adopt a Senior event over the holidays, which generated so much generosity, they were able to provide holiday gifts for residents at not one, but 4 assisted living communities. A team for an integrated care provider who worked with the Arizona NFL Alumni Association to bring attention to mental health issues. Now more than ever, our efforts are truly needed. The work that each of you do is so important. We're grateful for your relentless commitment to improving the health of our community. On behalf of the Mercy Care Board of Directors, congratulations to all the RISE nominees and honorees. We thank you for working alongside us to fulfill Mercy Care's vision of helping our members live healthier lives and achieve their full potential. And now I'll turn it back over to Catherine.
Thank you, Bob. We are so grateful indeed for everyone's dedication to improving health and wellness. And now let's turn our attention to Jamie Snyder, the Director of Access.
Good morning. I'm Jamie Snyder, the Director of the Arizona Healthcare Cost Containment System, or Access. Thank you for joining us for this year's RISE Awards. Congratulations to all of this year's nominees and honorees. The quality and number of nominations again this year continues to show us how much good work is taking place in the community, promoting resilience, innovation, strength, and empowerment. Access's mission is to reach across Arizona to provide comprehensive quality care to those in need. Thank you for all you do to partner with us in fulfilling our mission. And thank you for being here today. Enjoy the show.
Thank you, Jamie. This year we have a special guest speaker joining us for Rise Awards, Brandon Lee. If Brandon's name sounds familiar, you may remember him from his days anchoring the news at CBS 5 and 3 TV in Phoenix. Brandon is a 5-time Emmy Award-winning journalist, a professional artist, a best-selling author, and the host of the podcast Escaping Rock Bottom, which focuses on mental health and addiction by talking with people in recovery about their experience, strength, and hope. In November of 2021, Brandon left his journalism career to open an art therapy studio in Phoenix. It's called Art of Our Soul. It's where he teaches art therapy sessions to people who are recovering from substance use, trauma, and other mental health diagnoses. He delivers hope and healing to people daily. And today he is here to share his story with us. Though we never had the chance to work together, he is one very cool guy. So please welcome our friend, Brandon Lee.
I think when you look at my life, I'm a pretty good example of sometimes what you see on the outside is not truly reflective of what's happening on the inside. I grew up in one of the most beautiful places in Orange County, California, on the beaches of Laguna Beach. And from the outside looking in, I had the most perfect childhood. But what so many people didn't realize was that I did suffer a lot of physical abuse and also child sex abuse. And at the age of 15, my life began to spiral. I became a sex worker at the age of 15, and I also became a drug addict. And then at the age of 21, I was living in New York City, and I was trapped underground on the morning of 9/11. And the only way for us to escape was to run for our lives to the middle of Manhattan. I pushed all of that down inside because I knew from an early childhood experience that I could go into survival mode. And survival mode for me always meant putting a smile on my face, excelling in sports and excelling in school so that everyone would leave me alone. As an adult, I decided to finally get sober because rock bottom looked like this for me. I was a main anchor in Los Angeles, California, and after the news ended, I would go out to the parking lot and I would get high on drugs. I ended up collapsing in a dark alley in the slums of Los Angeles, and I ended up in a coma on life support at Hollywood Presbyterian Hospital. I had so much bleeding in my brain from that fall that the chief neurosurgeon looked at me and he said, "Brandon, if we do not perform brain surgery on you in the next 48 hours, you will likely die." I was not done. I unhooked myself from those machines on life support, signed myself out against medical advice, walked down Hollywood Boulevard wearing a hospital robe and socks, found my truck, and got high again. I woke up in the same coma, in the same ER a week later with the same team of doctors around me who had saved my life again. And for the first time was shown a lot of compassion on that day by a little nurse who held my hand and said, "Brandon, do you believe in God?" And I looked at her and I said, "No, I don't." And she says, "Don't worry, because God still believes in you. I'm going to give you $10 out of my pocket. Make me this promise that you will use this $10 and you will go to my church when they release you. And they have an AA meeting there every Thursday night." And I went to that meeting and have been sober ever since until 2020. The pandemic hit and it messed with all of us, myself included. COVID became my everyday. George Floyd was murdered, had to cover all those protests and the rallies, and then cover an election in Arizona. I experienced so much trauma that year that I began to violently shake, and I lost all hope in November of 2020, to the point that I relapsed after umpteen years of continuous recovery. The shame of that relapse was so heavy that in January of 2021, I attempted to take my life. because I did not see a way out for me anymore. It is also the same time where I finally started to do inner child work with my shaman to heal from all of the childhood trauma that I suffered and also the trauma that I've suffered as an adult. So in April of last year, I headed to the art store for the first time in decades, and I began to paint. In July 8th of 2021, not even a year ago, I woke up from a dream that was clear as day. There were 3 words written on my nightstand: studio, gallery, and school. And the dream was to leave news after 22 years and to open up an art healing studio for trauma survivors just like me, to teach other trauma survivors the gift of art as a modality so that they too can heal in the way that art has helped me heal. On November 1st, I opened up Art of Our Soul, an art healing program. Each and every day, the people who walk into this art studio are recovering addicts, survivors of sex trafficking, children who have suffered horrendous child abuse. I get to work with them every single day. They say that I'm helping them. What they don't know, they are helping me heal. This space that I'm sitting at right now is a healing space. I share that with everyone because it is my life's goal to rid the stigma of shame around relapse and mental health. Let me be an example to never give up on somebody just because they've hit the lowest of times. And the next time you see somebody on the street homeless, the next time you see somebody who is struggling with drugs or alcohol, do not shame them. Look past that. Have empathy and compassion for the trauma that that person has gone through and help them.
Thank you so much, Brandon, for that inspiring message of hope. And now it's time. We received a record number of nominations for the RISE Awards. This year we had 210. You heard that right, 210 RISE Award nominees. We had to give the evaluation committee an extra week just to read through all of them. So everyone who was nominated should be especially proud because your work is noticed and it is truly appreciated by us and by everyone whose lives you touch. As everyone who is tuning in today knows, it isn't always easy to do this work. We are proud to partner with many organizations and individuals who work tirelessly every single day to continue improving services and reaching out to engage those who need those services the most. So let me tell you a little bit about the RISE Awards. The RISE Awards honor an individual and a provider in each of 3 categories: compassion, innovation, and advocacy, and collaboration. The recipients of the Compassion Award spread a message of hope. They understand the importance of treating the whole person. They make sure that people who make important decisions about healthcare hear the members' stories. They help others have a positive outlook on life. The recipients of the Innovation Award use innovation to improve how people get care and other services they may need, such as safe housing or healthy food. They do this by developing new programs, executing on new ideas or ways of doing things. And in doing so, they often transform how all kinds of healthcare services are delivered. The recipients of the Advocacy and Collaboration Award advocate for improvements in healthcare and services that impact people's well-being. They speak up on behalf of people who can't or for those who aren't always heard. They work to raise public awareness regarding important health issues. They partner with others to create positive change in the community. First, in the individual category for compassion, here are all the nominees. And the RISE Award for Compassion goes to Jessica Newborn. Here is part of Jessica's nomination. Jessica embodies compassion and service to others and has dedicated her life to doing so. A simple hug from her can turn someone's entire day around. She has held people when they are sad and celebrated with them when they hit a goal. She truly loves these residents as if they were her own family. And now Jessica will share a few words with us.
It is such an honor to be able to receive this award. Thank you for those who have nominated me. Thank you for all those who have supported me to get to this place and to be able to succeed and do what I do on a daily basis. You know, something we see with our older population is that sometimes when they kind of get to their age, they just get forgotten about. So I'm thankful that me and my team can be those people that come alongside of them and just continue to encourage them, telling them that they haven't been forgotten. We're still here for them, that anything is possible, and we're their family. I can honestly say I have an amazing staff that works alongside me. I thank them for showing up every day with courage and just being brave to face the next day. I know in healthcare right now it hasn't been easy, but they continually show up every day, make sacrifices for loving and caring for our residents.
Congratulations, Jessica. And now in the provider category for compassion, take a look at all the nominees. And the RISE Award for Compassion goes to Jeff Spite and the Mind 24/7 team. Here's part of their nomination. Jeff and Mind 24/7's motto is, everyone gets seen and helped. It doesn't matter if they have insurance, their doors are open to everyone in a mental health crisis. And now a few remarks from Jeff Spite, accepting the award on behalf of Mind 24/7.
Our entire mission is to be there for anybody who has a mental health need at any point in time. We build everything so that we could just always say yes. And for us, that means we get everybody from 3-year-olds to 99-year-olds, and we get them in every shape and condition they can be in. And for us to be there when they really need us, it's a reward in of itself. To win the award speaks volumes to what our team here at Mind 24/7 has done. We started out with 8 people in a PowerPoint in May. We're now 500 team members and soon to be 3 locations. We've helped almost 4,000 individuals here in Phoenix since we opened our doors, and excited about helping so many more. We also want to be really thankful to our partners, whether that's been Mercy Care, Access, DHS, law enforcement. So many of the fellow providers in the community have come to support what we do. It's been a wonderful thing. This award really goes to that entire team of 500 plus our partners. And let's keep helping the people who need it the most.
Congratulations to Jeff Spite and the Mind 24/7 team. And now in the individual category for innovation, once again, here are all the nominees. And the RISE Award for Innovation goes to Sherilyn Yazzie of Coffee Pot Farms in Dilcon, Arizona. Here's part of Sherilyn's nomination. COVID-19 hit the people of the Navajo Nation especially hard, and it wasn't just the virus that wreaked havoc on these families. The resulting supply chain issues, especially with necessities such as food and water, created a frightening level of food insecurity for the residents living in this remote part of Arizona. Sherilyn had never grown food before, but she taught herself how using online classes. And in 2021, Coffee Pot Farms produced 12,000 pounds of fresh produce on less than an acre of land. Here is Sherilyn to share a few words with us.
My name is Sherilyn Yazzie, and she'e wanagahni shlin tutsolni bashishchin ashihan dashanelado twidij imi dashiche. And that's how I acknowledge where I come from, who my ancestors are. I'm from Navajo Nation in Delcon, and my husband and I, Mike, we have a small farm where we're growing vegetables on our little plot here. The reason why we're growing vegetables and trying to do this in our environment is because just kind of understanding why it's important for us to, contribute to the future. Our mission statement is that we grow quality vegetables for our community to inspire them to be healthy so that they can feel connected from their ancestors to their descendants. And I feel like every day that, when we say that or when I think about it, it really helps to lead me into this purpose and why we're doing what we're doing. And I want to say thank you for recognizing that work, to be awarded and recognized for our work at Coffee Pot Farm. For Mike and I, we're very happy to accept that award.
Congratulations, Sherilyn. And now in the provider category for innovation, first, all our nominees. And the RISE Award for Innovation goes to Valleywise Health First Episode Center. Here's part of their nomination. A young person overcame multiple traumatic events, including psychosis, resulting in justice involvement, the deaths of his grandmother and a sibling, and a tragic accident that left him paralyzed. The First Episode Center provided unbelievable support and advocacy to ensure he received appropriate medical care. The team worked with Mercy Care and Altex administration so they could continue to serve him and support his family. And now a few remarks from Dr. Eris Mosley accepting the award on behalf of Valleywise Health First Episode Center.
The reason why that we do the work that we do here at the First Episode Center is because we want to be able to provide support for young people and their families when they're experiencing the first episode of psychosis. We want to do that with dignity and respect. That is why we do the work that we do. We're super excited that we've been selected because the work that we do is so important, I think, for the community locally and the community at large. So it's just nice to finally have behavioral health kind of in the spotlight so that people can see the great work that we do and that we can continue to do it. We here at the First Episode Center would like to take the time to thank first all of our members that allow us to serve them and their families. So thank you to them. Big, huge thanks to Vicki Staples, who nominated us. We'd like to thank Jean Cavallo and just Valleywise as a whole. Would like to thank Mercy Care for this opportunity. And I would like to take the time to personally thank my entire team for everything that they do that allows us to be as amazing as we are. So thank you.
Congratulations to Valleywise Health First Episode Center. And now in the individual category for advocacy and collaboration, let's pause to take a look at all of our nominees. The RISE Award for Advocacy and Collaboration goes to Demetra Presley, Executive Director, Go With The Flow AZ. From Demetra's nomination, Demetra created Go With The Flow AZ, a nonprofit organization to collect menstrual products and distribute them to Arizona schools so that young people whose parents struggle to afford supplies wouldn't miss school to manage their cycle. Her advocacy to educate the community about period poverty has expanded Go With The Flow's work to include serving shelters for domestic violence survivors and people experiencing homelessness, and resulted in better treatment for incarcerated women. Let's hear from Demetra.
Thank you, Catherine, for that introduction, and thank you, Mercy Honors, for this incredible recognition of the work that is being done in Arizona to address the issue of period poverty. Currently in the United States today, 1 out of 4 menstruators has difficulty affording period products. Homeless menstruators, or those who are low income, are often put into a situation where every month they are extending the shelf life of the items that they do have access to, or making items out of things that are very unhygienic, such as paper towels and socks and newspaper. 1 out of 5 students in the United States will miss class or an entire day of school just because they don't have access to a period product to help them manage a perfectly normal and natural and healthy bodily function. Across the United States and across the world, menstruators lack the access to period products that they need in order to work, in order to participate in their education, and in order to engage in daily activities. And this lack of access is not only related to period products themselves, but also the education, information, knowledge, support, and facilities to be able to manage their cycles safely. I am incredibly humbled that Mercy Honors has taken this opportunity to recognize this issue, and it has allowed Go With The Flow to have a larger platform where we are able to bring attention to period poverty while also providing people with education and the resources that they need to address this issue in their community.
Extraordinary and important work, Demetra. Congratulations. Now, our final honoree in the provider category for advocacy and collaboration. Here are all the nominees. And the RISE Award for Advocacy and Collaboration goes to Copa Health MACT Team West. Several Mercy Care members sent us nominations about Copa Health MACT Team West, and here is an excerpt from one of them. They saved me from myself. They treated me with respect and dignity and fought for me to show me that I could find a life worth living and gave me hope when I was lost. This team fought for me when I was dying, when I tried to take my own life. They were there to bring me back. Let's hear from Gail Salentis Engel at Copa Health MACT Team West.
MAC was started in 2015 as a brainchild by Copa Health Chief Medical Officer Dr. Darwin Chern and former PIR CEO Christy Dye. MAC was a unique concept of integrated care working on modifiable risk factors in order to improve the lives of members. Our dedicated team works together to help our members experience some wonderful moments. For example, there was a time where we all took a field trip to a spring training game where one of our members almost caught a home run ball. Or the time where we put up a Christmas tree and members put their handmade ornament from the art group. And who can forget our MAC Talent Show, where members got a chance to display their hidden talents with the help of their talent coaches. My team and I are so grateful to receive this RISE Award. Even though we've won this twice before, the feeling of excitement is still the same. Thank you, Mercy Care, for this wonderful recognition.
Congratulations to Copa Health MACT Team West and to all of our RISE Award honorees. And now we present the annual RISE Awards Lifetime Achievement Award to a distinguished individual who has had an unparalleled impact on Arizona's healthcare industry. Our Lifetime Achievement Award recipient this year is Linda Hunt, who retired in April as the president of Dignity Health's Southwest Division. Linda began her healthcare career as a nurse. She became a nurse leader, a hospital executive, a hospital president at St. Joseph's Hospital and Medical Center in Phoenix, and finally a division president within Dignity Health. She is also a former chair of the Mercy Care Board of Directors. Linda was instrumental to Medicaid expansion in Arizona following the Great Recession, which included the restoration of funding for kids' care. Her leadership and collaboration meant 30,000 kids whose parents made too much money to qualify for access but didn't have employer-sponsored health insurance received the care they needed. Each step of the way, Linda has led with a servant's heart, grace, and purpose. Here's more about the impact Linda Hunt has had in Arizona.
A lot happened in 1970. The world held its breath for 4 days, hoping the Apollo 13 astronauts would return home safely after an equipment malfunction aboard the spacecraft. The U.S. celebrated its first Earth Day, and Linda Hunt graduated from nursing school an event that led to a career spanning more than 5 decades of service to the healthcare industry as a nurse, hospital executive, division president and CEO, chair of the Mercy Care Board of Directors, and community leader. And now, she is the 2022 Mercy Honors Lifetime Achievement Award honoree. In 1998, Linda joined the Dignity Health St. Joe's Hospital and Medical Center leadership team.
I was one of 2 candidates for a CEO role for a system in Colorado, and I had worked for them. And before they announced who had been selected, they came to me and said, "We think you're great. We think, you'd make a wonderful CEO, but you're a woman and we can't put a woman in this role." So I picked myself up and I sort of did okay, how do I continue to really think about this? So then I applied and I was given the job at St. Joe's and then became the CEO.
Linda would eventually become the president and CEO of Dignity's Southwest Division. Throughout her career, Linda's mission has always been to deliver world-class healthcare to the community, especially the most vulnerable. Her leadership was key in advancing innovation, integrated care and service delivery, Medicaid restoration and expansion, and the expansion of medical education and services provided, just to name a few.
When I think of her leadership and I think of her legacy as a leader, I think of a great degree of thoughtfulness that she brings to whatever she's involved in, purposeful, specific and purposeful. What are we going to accomplish, which leads to inquisitive. Linda was always one asking the right questions and trusting that people around the table, if they didn't have the answers, they would certainly go find them out for her.
She's an idea a minute. So if you've ever worked with her, you know that she's constantly thinking about new ways of approaching how to take care of patients and family members.
What I look at is just the way she interacts with everyone, the way that she, is able to have such an impact and often, turn to within the room as kind of the leader and the person that we all aspire to be. So I think her leadership within healthcare is truly remarkable.
One thing that sets her apart is her ability to promote teamwork and collaboration. Even among people who may be in complete disagreement with each other, philosophically, politically, or otherwise, Linda is able to build consensus and keep everyone focused on the end goal.
I think she always made it clear with Mercy Care that our job is to make sure people's lives get better. And I think that's always been the driving force of why Mercy Care has been the lead in Arizona for so long, but really it comes from her leadership.
When Linda says she's going to do something, she does it. And that is the part of leadership that I so appreciate about Linda. It's her honesty and her integrity.
Linda's drive to make a difference didn't stop with the healthcare community. She's used her experience, influence, and leadership skills to address critical issues around the valley because she believes that a healthy community and healthy people go hand in hand.
I think her legacy will be one of tremendous innovation.
She does what she believes is right. I think she wants to be as helpful as much as possible, whomever she's engaged with.
When I look at her, she's just been an inspiration, someone that I aspire to be more like, and also just such a wonderful mentor and leader for all of us here at Mercy Care.
Well, I think when we look at Linda's legacy, what we know is it's been tremendous. And what we hope is that those who will follow her will be able to do the same and will seek to be as engaged in the broader community as they are with their actual professional position.
It's going to be sad to see her leave as a board member because I got to tell you, she's influenced me, and I think I'm very fortunate to have had the opportunity to have worked with her for so long.
She has a wonderful heart and a wonderful spirit, and you just enjoy being in her presence and working with her and working together with her.
On behalf of all Arizonans, congratulations, Linda, on an exceptional career.
Her contributions both to Mercy Care, to the healthcare community, to Arizona will never be forgotten. So thank you and congratulations, Linda.
Here at Mercy Care, we are grateful for Linda Hunt and her leadership. Her vision and legacy will continue to improve the health of our community for generations to come. Now let's hear from Linda herself.
Thank you for this recognition, and really thank you to Mercy Care. When you look back at where we started, it's amazing where we are today. The number of people we touch is amazing to me, and they get great care. I really want people to remember me as a person first, and that I lived the vision that the Sisters of Mercy had. And I walked the halls of St. Joe's when I first got here and looked at these pictures and talked to the Sisters of Mercy. And I understood how they felt about people and how they felt about this community. And they felt about the mission, vision, and values that they had. And my goal was to carry out their legacy. I guess I just put one foot in front of the other every day and just tried to do what was it that the people in this community needed and this state needed. I'm very proud of everything that we've done. And I think we're serving people better today than we were when I first got here. So when I look back, I think I always tried to do what I thought was right. It wasn't always right, but I thought, unless we try, how will we ever know? And I also saw needs, and I don't accept the word no very often, or, well, I don't think you can do that. Well, that just gives me even more emphasis on trying to prove that, yes, we can. When I look back at who I am and what my parents taught me and what life has taught me, I think my guiding principle is, first of all, be open, be a good communicator, be a great listener. That many times what you think is the answer isn't, because you have only looked at it through your lens. And when you bring other people into the conversation, many times the solution is not where you started from. If I hit a roadblock going one direction, I'll back up, reassess, and go another direction, and try to bring as many people along with me, not being convincing, but listening and trying to really say, what is it that we're trying to accomplish? What is it that we need to do to break this logjam? And so I think the thing I want people to know is that I'm tenacious. I have the best for people in this community at heart, and that I have been privileged to have wonderful people who've been there helping me along the way. I could have never done this by myself, that it really has been a group effort, and it takes everybody's ideas to make things happen.
Once again, congratulations to Linda Hunt, our Lifetime Achievement Award recipient, for her incredible impact on our state's healthcare industry and her service to Arizonans. We also want to once again congratulate all of our RISE Award nominees and honorees. Thank you all for joining us today. We're encouraged that next year we'll be able to celebrate in person. Until that time, we wish you health and happiness. We hope you all have a fantastic day.